Welcome to Pharmacy IR. This is a show that's dedicated to learning about pharmacists in very unique fields of pharmacy, learning about what they do, what got them to that field, and what kind of recommendations they have for students or possibly new graduates to pursue a similar path. Today we have Keta Dodds. She is a pharmacist that also works in functional medicine as well. And so I'm extremely excited to talk to her. We're going to learn a little bit about functional medicine, about what she does, and get to know her business a little bit, which is Revelation Wellness. Get Rev Well is her website, and I'm going to continue to mess that up. So,
okay.
Hey, welcome.
Hey, thank you. Excited to be here.
Yeah, so tell me a little bit about functional medicine.
So functional medicine is, I like to think of it as a tree. So our bodies are the trunk and our arms. And then the leaves are actually the symptoms that we see every day, whether we're having hives or high blood pressure or myalgias or fibromyalgia or gut issues. That's what we see on the outside. But then what's really happening can be found in the roots. And so functional medicine really just looks at the root causes of what's really happening in our bodies to kind of figure out what's happening with the symptoms.
Yeah. So what is kind of day-to-day work in functional medicine kind of look like? What kinds of problems are you solving? How are you helping patients out?
So that's a great question. It varies, actually. I love gut health. I think that it's great. So a lot of times people will come to me that just are having a lot of digestive issues, or whether they're having constipation or diarrhea, just having a lot of just gut issues, not feeling well. So we'll do a stool test, a very involved stool test. It's a 30-page result stool test.
Oh, wow.
And yes, and we'll go through that. I do hormones. So you have, right now I have a fertility patient that's trying to get pregnant with her second child. And we just discovered some really pretty big hormonal imbalances that we're going to work on. Another client has chronic hives. So we're working through that. But it depends. Really, it's a lot of research and looking into taking an in-depth history and looking into what they specifically have and the little nuggets of information that they give and figuring out what the problem is and addressing the root cause.
Cool. Yeah, I can see that. And so with your background as a pharmacist, that, obviously very healthcare related, that when folks come to you and they've got certain medications and you can kind of link those up with disease states and kind of mesh like what might be going on. How do you feel like your knowledge as a pharmacist or healthcare provider, because that's your previous history, how does that help you in the world of functional medicine?
Absolutely. I think that's huge because most patients are on medications. And so it's really important to look at what their meds are. And with the pharmacist background, I'm able to kind of pinpoint any side effects that they're having to their medications. And so we can work through the medications and see if they're really having side effects or there really is a root cause to it as to why they need the medication. Yeah.
Are there certain medications that are kind of are more red flags for you? You're like, okay, let's try to get you off of this, or...
So my favorite, as you know, is proton pump inhibitors.
Sure.
So I love to get people off of proton pump inhibitors because of just very bad side effects with it and long-term bad side effects for sure.
Yeah, so. Yeah. Most people seem to be on a lot of PPIs too long, for sure.
Yes, a long time.
Yeah.
Yes.
Excellent. Yeah, so PPIs certainly are a bugaboo, so to speak, for pharmacy, I think, all across the globe, whether you're in a hospital setting, whether you're in retail. What got you into, so as a pharmacist, you worked in more of a retail setting, and then you kind of had this epiphany where you wanted to start your own. How did that start?
I had a revelation.
You had a revelation.
Revelation.
There you go. Yeah, that's right.
So I was trying to work through some health stuff for my son, and I saw an integrative doctor for that who really helped us work through specialty testing, root cause analysis, and we found some genetic factors. We found some mineral nutrient imbalances that we worked on, but we were able to really help get him to a different place than what he was. And so then literally I started doing some research and I was like, is this the thing? Can pharmacists do this? And actually, there's quite a bit of pharmacists that are into functional medicine and can kind of pave the way, and just you're still helping patients and you're still using your pharmacy knowledge, but you're helping them in a little bit different way.
Yeah, you can select, which one is an evidence-based medication for preventing, or for treating an infection. Well,
Right.
okay, well, an antibiotic, we might
Exactly.
need this, but in some cases, it's like some of these chronic medications, can
Right.
we back people off of those?
Right,
And
exactly.
to not have an indefinite end date for them on those medications.
Exactly.
Excellent. Yeah. When you started your business, like, what made you feel confident that you were ready to kind of jump into this world? And
Whew.
I know, I guess going to the Secretary of State's website, I guess, and
Yep,
like doing
I
your
did
LLC.
doing the LLC, and then it was just putting myself out there, on social media or just friends. And so I think my first few clients were really just friends that had issues, and then it's been just referrals pretty much ever since. But
Sure.
it took a while because I did about 2 years of schooling and studying, and then it was just honestly like I've got to get my confidence. But really, it just came with each patient. You learn something different, and you're able to dig a little deeper and help them, and your confidence just comes.
Sure. Yeah. So getting some training and learning about that. So where did you go specifically for?
So there are quite a few functional medicine like certifications, I guess. It's not really a degree. So there's several of them. It just depends. They're usually about 2 years in length. They're 6 months to 2 years, and you can just kind of pick because they can be a little pricey. So you can kind of pick. So I did just a 6-month course, and then I went and did a 3-month ADHD intensive with a integrative psychiatrist. And then I have pretty much just been part of a clinical academy since, where it's just amazing resources and
networking. I'm sure
networking. Yeah, there's all kinds of webinars every day that you could just log in and get tons of even free information.
Yeah.
From different specialty lab companies. So yeah,
Cool.
there's tons of information out there.
Awesome.
You probably wouldn't even have to go to school. You could probably just jump on all the webinars.
But like you said, like the confidence, knowing what you're doing, knowing how to help patients best, and like having that training certainly builds your confidence, and like I can do this, because if you're going to start your own business and like you don't want to just jump fully in, like I know you're kind of doing some like kind of hanging on to some of your retail background to a degree, working in the compounding as well, to not have to just jump in head first and just be like, here we go, hope it works.
Yep.
So I mean,
I'm kind of stepping in and testing the waters.
Yeah, absolutely. And I've always wanted to start my own business, whether it's just like design work or something. I've always wanted to do that, but I've always been so nervous about it, and like. So I've started to get some like training in educational education and design and things like that. And I'm like, okay, maybe I'll start something with that. Maybe that'll be what I do.
Just jump in, just do it.
Yeah, I need to. I need to actually. Yeah, maybe I need
it.
to find some networking folks to kind of some online groups or something like that.
Absolutely. Yeah.
So, what are other resources that are available that are out there for functional medicine? That folks can go to?
There is actually a functional medicine pharmacist alliance. Group.
The Functional Medicine Pharmacist Alliance.
Yep, FMPHA. It's started by a pharmacist, actually, Lauren Castle. So she has amazing resources out there. If somebody would just join it, it's kind of like APHA, but it's for functional medicine, just strictly for functional medicine. So it's just a yearly membership.
Yeah.
That's a great resource.
What do you think it is? I mean, knowing that group's out there, what do you think it is that like draws some pharmacists to like functional medicine? Because you always say like, I'm against medicine, and like and so, like, jokingly, right?
I think that over 20 years in retail, and I've really seen patients not get better. They're not getting better. They're coming in with more and more medications, more and more side effects from the medications, and then especially when you're talking about mental health, it's trial and error. I mean, they're just constantly trying different things, and I think that so much can be done with lifestyle modifications that just aren't being prioritized. But for me, it was when you have a patient that gets to wanting functional medicine, they're ready. Like they're ready to make the changes. Whereas I think a lot of people are not ready to make the changes. So the patient has to be in the mindset and really disciplined to be like, okay, I'm ready to feel better. I'm ready to get off some of these medications. I'm ready to do whatever it takes. And so a lot of times just people aren't there. But my hope is that when patients get put on medications, that it doesn't have to be a lifelong thing, that it can be something, short term, fix the acute issue now. Let's work to figure out what's causing the high blood pressure, for instance, and work to get off of that.
Right.
So,
Yeah. I love that. Speaking about or thinking about not having, you know, being frustrated by patients just not getting better and
mhm.
just not being able to have the time to be able to counsel them
Right.
and provide support and
Right.
advice and with someone who's trying to stop smoking, it's good to have an accountability person and,
Right.
that type, you wanting to be that type of person for someone and being in retail
You
sometimes.
can't.
Yeah,
You
it's very
can't.
difficult
Yeah,
sometimes.
unfortunately.
Yeah. So that also kind of we are both mutually friends with Melissa Turner,
Mhm.
and she does pharmacogenomics, and it kind of gets at that same thing too. It's like,
Mhm.
okay, I see a lot of what feels like trial and error. Are there ways that we can prevent some of that trial and error by looking at your genomics first and then
Right.
selecting more appropriate
Exactly.
medications? And
I think pharmacogenomics is huge, especially for mental health.
yeah,
For sure.
for
Yeah,
sure, for
it's
sure.
huge.
So a lot of folks that will listen to this are going to be students and maybe new grads. So what advice do you have for someone who is potentially interested in functional medicine?
I would say you could even pursue a functional medicine certification while you're even in pharmacy school, because a lot of them are kind of work at your own pace. So there's a lot that you could do.
Mm,
Maybe, your fourth year, especially when you're not studying so much, just doing rotations. But I think that if you're interested, you have to be willing to think outside the box, because a lot of what you're taught is different from functional medicine. So it's not so much it's opposite, but it's just a different way of thinking about things and looking at things. We're taught in pharmacy school that hypertension has to have medications, and a lot of times hypertension can come from a root cause, and it's a symptom of something else happening versus a disease state. So I think you have to be open to being able to kind of see both sides and use both sides and use your pharmacy knowledge and what you know with some of the things that you would learn from functional medicine. So I think as a pharmacy student, you could easily, and there are programs out there that do offer, programs while you are in pharmacy school.
Right.
And then it would just open up, especially, I think one of the best places for a pharmacist to use functional medicine would be like ambulatory care, because you see the patient on a long-term basis. Like you can follow
you have
them.
an hour-long
Yes,
meeting with
you
them.
see them, and they're going to come for follow-ups, and you can, progress, and you can do specialized testing with them. So that would be an amazing place.
Yeah, you have direct connection to
Yep,
a physician
exactly.
to make
Yep.
changes. And
Exactly. That would be a perfect place.
Yeah, excellent. In terms of jumping into functional medicine, like as a student, is this something that you feel like would be like a good first area to kind of jump in pharmacy and healthcare?
Oh, I think it depends on your interest. I mean, I think for me, I'd seen 20 years of patients not getting better. And it saddened me because I don't feel like I was really helping them.
Right.
Because as a retail pharmacist, it's hard to help somebody, right? Because you're having a 5-minute interaction with them, and that's it. So I didn't feel like I was helping them get better. So to me, it was kind of just a way that I could truly help people feel better.
Yeah.
So I think if you have somebody that's generally curious and likes kind of more the natural side of things, then I think it would be a great fit.
Cool.
And I'm sure there are some internships or rotations out there. And I don't know.
Yeah.
I haven't looked because I've already
It sounds
graduated.
like there's at least mentors. And
Oh,
things
yes,
like that.
absolutely.
Yeah,
yes,
absolutely.
for sure.
Cool.
Yeah.
Anything else that you want to discuss with functional medicine, and any other advice that you might have just for student pharmacists in general?
I would say don't be afraid to take a chance. Don't be afraid to take a risk. Yeah, just to do what interests you. So just put yourself out there.
Yeah. Well, thank you so much for coming in. I really enjoyed talking with you and
Sure.
learning about functional medicine. So thank you so much for being here. I know it's a drive.
Yeah,
so.
It's perfect. It's no big deal. Yeah.
Well, thank you. Thank you for watching this episode of Pharmacy IR. We'll see you next time.